Good afternoon, everybody, and welcome today. Thank you so much for taking some time out of your day to join us here. Super excited for our guest today. Today we are going to be talking about all things devoted. So before we dive into that, just a few quick housekeeping pieces for everyone. If you have any questions as you go, this is very much going to be kind of an informal interview style conversation with Matt and myself. But please feel free to throw any questions that you have in that question section on there. I've got those popped up and handy. We've got a few that we'll talk through here, but we'll definitely try to take some questions at the end if we have those. So again, welcome everybody. I am Matt Carson. I am our Vice President of Sales here at Senior Marketing Specialists. Again, we are here to talk about Devoted today. So Devoted is one of the fastest growing Medicare Advantage carriers across the country right now. Matt will probably correct me and say the fastest growing if I have to guess. But they have quickly moved from being a regional player that some of you may know of, some may not have had, to very quickly moving into the national conversation. So I am joined here today by Matt Rao, who is their Associate Director of National Partnerships, to talk today a little bit about it. So thank you, Matt, for taking the time to join us.
Hey, glad to be here. Thanks for having me.
So I'm going to just kind of jump in here with a few, maybe the easy and obvious one right off the gate here. I've talked about, kind of in that intro that Devoted has been, doing things different than other carriers and, just growing crazy fast. And I definitely want to get the chance today to talk about what makes Devoted different. So let's just start with that, Matt. Tell us, as Devoted has experienced this incredible growth from being in a few states to being nationwide and just unprecedented enrollment numbers, what makes Devoted different from so many of these national carriers that you guys are now really becoming the same size as?
Yeah, it's a good question. It's a big question. I think there's a lot of ways you could probably answer it, to be quite honest, because narrowing in on one key attribute would be tough at this point. I would say, though, it really starts at the top, starts with our leadership, and that is Ed and Todd Park. So Ed and Todd Park are brothers, are from Ohio, and just as like a quick background for everybody on them, in the early 2000s, they started a maternal care and navigation clinic called Athena Health, and it was originally designed to drive improved outcomes and healthier babies, healthier mothers in underserved communities, right? And they had great success from a clinical standpoint, but unfortunately, as many things work out from a business standpoint, wasn't as successful. And so they pivoted that and they turned that into Athena Health, which is the third largest, I think, electronic medical records company in the United States. Still powers a good chunk of doctors' offices to this day. So they start this company, and then in about 2008, they take it public. And at a lot of points, I think, for me at least, going public, like I'd be like, all right, cool, I might be out of here for a little while. Not these two. Ed stays on and runs Athena as a publicly traded organization. Todd left and founded another company called Castlight, another healthcare company, which he then took public, at the same time as becoming the Chief Technology Officer of the United States of America. So they're pretty talented guys,
yeah,
to say the least.
I love that means like this is like such a passion project for them. Of like, I think you've said that before. Of like, these are guys that kind of know everything there is to know and have already had more success than most people could dream of. And like, their idea is let's start a Medicare Advantage insurance company.
Yeah, right. So like that's it. They have this super unique vantage point on U.S. healthcare that probably nobody else combined is going to get, and especially not for two brothers, right? It's crazy. And so they kind of come back together in like 2016, 17, and they're looking at each other and they're saying, we have major problems in U.S. healthcare, like to the tune of, we're going to spend probably $525 trillion on healthcare this year in the United States, which is, I'm sorry, not that much, $5.25 trillion. Sorry, to get my numbers right. Either way you cut it, it's a lot of money. And to put that number into context, that's like that's larger than both the German and Japanese economies. It's a crazy amount of money. And for that, we're not getting great results. Like we've got statistics like the rate of preventable deaths, which we rank about 60th in the industrialized world, on par with countries like Cuba. So not great. And it's not because we don't care, and it's not because we don't have great doctors or technology. Really what it is it's a lot of fragmentation and compartmentalization and silos within our healthcare system.
Yeah.
There's just a lack of coordination in general. And so they see this and they come back together, and their question is, how do we fix US healthcare? A question I would have never asked myself. And instead of like riding off into the sunset with all of their massive amount of success, they realize that the best way to do that is to start an insurance carrier, because insurance drives a lot of healthcare at this point. And they realize that where did the cost spike? Over or about the age 60. So we'll start a Medicare Advantage company, and we will focus 100% on that. And we've been doing that since 2017. Enrolled our first members in January of 2019. And after this last AEP, we are the 8th largest Medicare Advantage carrier by way of membership. That took us up from about 20th the year prior. So on a percentage basis, Matt, we were indeed the fastest growing.
That's what I thought.
Inmate carrier. Yeah.
Yeah,
So,
I love that. Like I said, I think it speaks to being founded and ran differently, which, as we kind of talk through this, really shows up and manifests itself in so many of the different ways that Devoted goes about doing business. Like you can tell that mission of changing healthcare is at the core of things before making money.
It absolutely is, and we have the benefit of being privately held, and probably will be privately held for, I don't know, a long time. It's just a company that's built on service, period.
Yeah.
That's what the difference is. And everything can come after that, contrary to what I think we've all been kind of, trained to believe through our own experiences within, dealing with our own insurance carriers or cell phone companies or cable companies. Like, we're not used to getting good service anymore.
Yeah. We talk about that all the time, of like just receiving like what you expect is almost considered great customer service nowadays, because like so many times you go into things and you just never even get what you're just trying to accomplish, let alone anything above and beyond an expectation.
Right. Yeah. There was a member testimonial that I used for a while, and it was like they answered the phone and it felt like I had gone back to 1955. And my mind immediately went like, I got to get into a DeLorean and go back to the future to 1955 to get good customer service. It's 2025, 26. What are we doing? Right?
Yeah.
It should be table stakes, but it's not.
Yeah. Yeah. So that's actually a great segue. So my next question is about, I remember, I think it was probably 3 years ago now, at your guys' carrier rollout that you had at the awesome headquarters there that you guys have up in Boston, right?
Yep, that's right.
Yep. You guys talked a lot about your member guides, and that stuck with us. That was something that Joanne Ray, our president, has talked about so many times since then, of these guides, and the fact that you don't refer to them as customer service reps or member care or whatever, they're member guides. So talk to us a little bit about that, and like what differentiates a member guide that a member works with at Devoted from, a customer service rep that you would typically be used to working with at a carrier.
Yeah. Member guides, that's right. For lack of a better term, or just to like equate it for today, we can call it, say it's customer service. First off, it is 100% US based customer care teams. That's the biggest call out, right?
Yep.
And it's built to scale. So it's really easy for us. Because we scaled during COVID, Devoted is probably 90+% decentralized as an organization. We have employees in 48 states. So it's really easy for us to recruit. And it starts with that, because we're not looking for necessarily like experienced call center people or experienced anything. We're looking primarily at people with high levels of empathy.
Yeah.
Right? People that are really good at starting a conversation and creating a relationship. And we have the good grace that because we all operate on one technology platform, we don't even really have to do much training. In fact, we don't even give them a script. It's just, hey, here's the phone, take the calls, build the relationship. And while you're doing that, figure out what this person needs. So it's a very relationship driven approach to customer service, in which we might have calls that last 40 seconds. We might have calls, in fact, that last over 4 hours. And so they're all the while they're trying to build this trust, which every opportunity we interact with somebody is that opportunity to gain or lose trust. And what's amazing is you start to see that they call back and they ask for the same person, right? And it's amazing. Go to our YouTube, check it out if you have any time. Watch the videos on our member guides, meeting a member that they've worked with and built this incredible relationship with. It's really like, it's some hallmark stuff. It'll create some waterworks.
That's so cool. I mean, that's like what we talk about as agents, right? Like that's the difference when they're not just calling and like,
Yeah.
hey, I need help with my plan G or my HMO plan. It's I'm calling to talk to Matt because Matt's my agent, and like whatever Matt tells me goes. I trust him.
And they can do all sorts of different stuff. So we kind of have 3 different flavors of guides. You have your kind of like, you know, I need a card, I need, you know, this or that, like the easy stuff. And, you know, we've rolled out tech this year that like makes us move even faster. So you're always going to have the human touch. AI for us will never replace the human, but it's going to enable the human to move even faster. So for example, like if somebody calls in, you know, all calls are recorded, and our system hears somebody say, yeah, I just need a new card. And then, you know, they verify what their member number is or whatever it is. Probably before they've even disconnected that phone call, our system has already ordered and sent the card. Like that's how fast we're moving. And so the member experience is really unlike any they're going to get. So you've got those guides. Then you have more of like a social guide. So these are guides that can help enroll people in Medicaid. They can help screen for unmet determinants of social, you know, determinants of health, I should say. And then you have our devoted medical member guide. So they can get, you know, the first D to me visit, that's a devoted to me visit, where they're going to do kind of a health interview. They're going to watch, say, turn your camera on, set it down on the table. We just want to see you walk around the room, right? Okay, great. Let's just like check. Then let's just take your camera. Let's walk around the house. Make sure there's nothing we can trip on. Like, what's the environment look like? What can we help with? Do we need to help you find safer housing? Like any sort of those things. And then they'll connect them to our devoted medical team, who can do amazing things through our digital and telehealth.
That's fantastic. I think the word something like, isn't one of the catchphrases something to the effect of like treat the member like family or something to that effect?
That's the mission. It's to treat every member like family, right?
Okay, that's what I thought.
And like mom and dad. So you know, that's everything we do to enable what we consider world-class healthcare, which is right care, right place, right time, delivered in a highly consistent and coordinated fashion.
Love that. Love that. So this is something that I know has stood out to us over the years. So I don't know if you have any specific ones here, but I remember we've heard some different statistics that kind of are like the measurables of your guys' customer service and just how far it exceeds the competition. And again, like we all know there's carriers that there's levels to it, there's better and worse, but from all measurable things that you guys have shared, like you guys really do set the gold standard on member service. Are there any of those you know, numbers or ratios or anything like that that maybe just emphasize where you guys stack up?
You ever have like one of those toys when you were a kid where you could pull the string and it just like says something, like,
Yeah.
and you know it? Like that's how it is for me with these stats now at this point, because I love them so much. When's the last time you called a service company? You know, like what was your time? I just called to cancel a hotel room. It wasn't terrible. I was probably on hold for like 12 minutes. Like that's not terrible.
Right.
Um,
But it's that example of like you expect the worst, and when you just get what you needed done, you're like, okay, that wasn't so bad.
Yeah. Wow, that was great. Thank you. You know, so yeah, I mean, and you probably at some point, because most people did, as we were starting to scale. When I came in, we were in 8 states. Now we're in 29, and after expansion, we'll be at 36 or 7, I think, for next year. I often got a question, really not a question, a state. I was told, right, Matt, that, well, this is great that you guys can do this for now, but you're never going to be able to scale this level of service as you grow.
I hear it every year.
Every single year. Less now than it was then, but yeah. I still get it. I've probably gotten it twice in the last 2 weeks.
Yep.
And the answer is yes. We are 100% built to scale, one-to-one human contact, whether we have 10 million members or 1 member. That's how it's built. So we have an SLA of how quickly we answer the phone, the first call resolution rates, And, we grew during AEP. We added 260,000 lives. We more than
essentially doubled, right? Yeah.
Yeah, 121% year-over-year growth. A lot of
member count, to be clear, not in year-over-year sales, in member count. You guys more than doubled your number of members in a single AEP.
That's right. We came in with about 212. We left with about 467, and now we're at 500,000.
Yeah.
So, I mean, a lot of growth, right?
Yes.
And that's the growth that we've seen in the space where it's like, ooh, they probably aren't going to be able to handle that.
A little too big, too fast.
Yeah, that's going to be a problem. So, few stats. During AEP, our average processing time for an application was 1.2 days, so incredibly fast. On January 5th, which was the heaviest call volume, it's like the first business day back after the new year and everything like that, right? It's the biggest call volume day of the year. Our average answer time was 16 seconds, 90% of the time. Right? Our SLA is under 30 seconds 90% of the time. Ours was running 16 seconds per answer with a 90+% first call resolution rate. Right? So it's
pretty telling.
It's insane. Now, I will say a cool story about that too. And this is something that I love about Devoted and how seriously that we take it. You can't staff that team year round for what you need in the first 2 weeks of January.
Right? That was literally what I was about to ask, was like the staffing considerations for this have to be considerable.
So we have a program we call Snowbirds, and everybody in the company chips in, right? We all get on the phone. So I was taking agent broker calls, like I was on the agent support team, where, by the way, we were answering all of our calls in under 1 minute all through that time period as well. So you guys get that too. But what was really cool was that Ed Park, our CEO, he was on the phone talking to members.
That's so crazy.
Park, his brother, who's a chairman, not even really in day-to-day operations, he was on the phone taking member calls. And none of us are trained to do it. But
can you imagine being that member that's just like, thanks for calling Devoted. This is Ed. How can I help you? And like probably have no idea.
No idea. And he wouldn't tell you, but he loves it. He loves it. And it's fun because we, for me, like I get to talk to brokers and it's like, how are we doing? Like, are we doing good?
Beyond just like the staffing consideration of how much I'm sure that helps, like you said, to not have to hire up a bunch of temps, which is something we see a lot. And a lot of times that quality dips because it's pick your poison, either keep all your full-time staff, but your hold times are through the roof, or staff up with a bunch of temps and you worry about quality going down. So like, obviously big help there. But what you were saying there, I love of that gives everybody such a real world look at, helping an agent on the front lines or helping a member on the front lines. Like, that has to give so much empathy to a marketing person, a salesperson, whoever that would never interact with a member otherwise, to pick up the phone and talk to 73-year-old Betty Smith.
Understand, right? You hear about it a lot, but unless I was an agent at one time, like unless you've been across the table or you just don't necessarily understand. You might hear a lot about it, but to get in that seat and sit there and take calls and hear the good things and the bad things, like we just take so much away from it. It's really just a great experience.
I love that. So we're talking mostly about the member side of things, because obviously that's where the rubber meets the road, have to take care of members.
Yep.
But I know in our experience, this is something you and I have talked about over the last couple of years and working together. A lot of times, I think agents feel like they kind of have to pick a little bit sometimes. You've got national carriers a lot of times that have good systems and processes to help agents do business efficiently. Maybe the member services, some are good, some aren't. Vice versa, a lot of times, a lot of the regional carriers, I think, are what people associate a lot of times with this level of member care and connection, where like you really expect raving client members. But a lot of times that comes at the trade-off of doing business with them as an agent. Sometimes things can be a little bit more difficult. So I know that's something that you guys have really focused on and tried to be a very broker-friendly company as well. So what are some of the measures you guys have taken to do that? What are some things that you think makes Devoted a carrier that agents want to do business with?
We're still paying commissions. That goes a long way.
That's very true. Yeah. There's that's a shrinking number of plans.
Yeah, I never thought after 15 years that would be a selling point.
Right, like we pay you. Yeah,
we actually do that. we have very little distribution outside of our broker partners. We have a small internal sales team that takes organic lead traffic off of our website. It's very small. I would say probably 90% of our distribution comes from you guys, right? And we really value that. It's without you guys, we're not doing what we're doing at this point in time. So we do try to mirror the exact same experience that members get to our broker. So like I said, just on like answering the phones, we're going to answer the phone under a minute. You're going to be talking to a human being with a 90+% first call resolution rate, right? Like that's the expectation. I think that's a big component of it. I like to talk about how our member experience though kind of bubbles up to help the brokers, right? Because it's those things that you don't always necessarily think about. But if we're spending all this time investing in the member, a lot of times what will happen is, especially early on, brokers will, everybody's calling to check in on everybody after 1/1. Hey, you get your card, got your stuff? No, I'll call this carrier for you. I'll call this carrier. Don't worry, you're going to sit on hold, blah, 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 blah. And then kind of notice that the devoted people are kind of quiet. I haven't heard much from those guys. They haven't called me. I wonder what's going on. So they call them and they're like, everything okay? I know we just put you with Devoted. Like, what's going on? They're like, oh my God, it's amazing. Like, I had my card in like 72 hours digitally and like a week afterwards, and they've called me 4 times. I've never called them 1 time, right? Like we average about 4 to 1 outbound to inbound dials to all of our members.
That's a pretty crazy statistic.
It's crazy. It's crazy.
So you're saying you call members 4 times as much as they call you?
Yeah.
So, which I will say is something I know we've talked to agents about, like you have to get used to as a broker, because I think that maybe that's something worth talking about here. Of like, there's been some bad experiences that many agents have had with carriers calling their members. And I know some agents that have taken to, maybe particular carriers that we won't name, saying like, don't pick up the phone if they call you, because usually it's to flip your plan or it's in some way, shape, or form to remove me from that equation. So maybe, talk a little about what those calls are and the AOR protections and things like that.
Yeah, we crave the interaction, right? It's like we're competing differently, right? We're not competing on network and benefits alone. That's why the service not like might scale, it has to scale.
Yeah.
Because that's kind of what like sets the hook.
Yep. You're not going to win on a black and white. We talk about that. Benefit spreadsheets are not where Devoted is going to win.
It's a commodity though. In the end, everybody's got the same stuff.
Yeah.
There's differences here or there, but it's generally all the same stuff everywhere. It's not like a med set, but it's
no, I hear you though.
We're pretty darn close, right? And so we keep this stat called boomerangs, right? People that leave Devoted and then within, I think, 3 months or 6 months end up coming back. Last year, 2025, in OEP, in market like Houston, for example, I think it was 38% of our enrollments were boomerangs. People that left in almost
38% of your OEP enrollments, you're saying, were boomerangs.
In the Houston market.
So those are people that had left during AEP and within OEP had already come back.
Yep. And for last year as a whole, 10% of all of our enrollments were boomerangs.
Wow.
So people get used to this level of handholding, this level of service, and then they like might leave for, I don't know, an extra $1,000
less move or another grand in dental or whatever. Yeah.
Yeah. And then they get over there and they're like, I don't know if that was worth it, and they come back, right? So that's what sets the stage, and that's what why that interaction is so important is because we are not waiting for the train wreck to happen and watch, and then maybe we'll pay some bills at the end if this really goes south. Our business model, Matt, is to actually get people healthier.
Yeah.
So we have to keep people with Devoted, because what we do is, high utilizer or no, we're going to bend that utilization curve over 2 or 3 years. We're going to actually help these people get healthier so that they become lower utilizers. And that's where the margin is. We're not cutting margin on service and by cutting heads, and we're not cutting. That's how you get on the benefit roller coaster, right?
Right.
Margins aren't in line. Let's cut the benefits. Who suffers? The member. And then by way of that, also the brokers, because you guys got to triage your books of business. Oh, where do we got to move this person over here this year? Like, we don't want any of that. That's why we design our plans for consistency and stability, so that again, another benefit for the broker is that hopefully by creating a stickier client, being more stable with our benefits, you can actually go out and grow your business. You're going to have to spend less time managing this book of business because we're going to do that. We're going to do that more than you, frankly, ever will be able to do.
Yeah.
Because it's just the way we build. So to that tune, like you were saying, do not change the AOR. If our team makes a plan change with one of your members, AOR is 100% protected. Because again, we value you. You're the ones that are bringing us the business. We are partners in this endeavor. And so it would be a pretty crummy practice, in our opinion, to take your business away just because we decided to make a change.
You would think.
Yeah.
Yeah.
So,
no, I love that.
It's all the little things, you know, and I think in the end, I right after I started here, I heard our chief of Medicare markets say something so simple and straightforward. He said, we're not doing anything new. We're just taking care of people.
Seems so simple at its core. And that's so much of this, like you're saying, like treat people like family, just do the right thing, just take care of people, try to get your members healthier. Don't screw with your benefits year over year. Take care of you. Like it's doing all the little things right.
Yep.
Yeah, I love that.
That includes you guys.
Yeah, right. So we talked a little bit about expansion and growth, but like I have to pause for a second and just really point out how crazy that rapid expansion has been for you guys. I mean, again, we just talked about in one AEP in 90 days, you guys more than doubled your size. And this wasn't from 10,000 to 20,000 members. It was from 200,000+ members to 500,000 members. Huge growth amounts there. You were alluding to it a second ago when you started with the company. That'd be plan year 23, I believe. It was 8 states that you guys were in. This next year, you guys are going to be in 35 to 37 states, depending, I think, on how the expansion market works out. But I mean, we're talking over 4 times as many states in 4 years. Talk to me about your feelings about sustainable growth and how you guys have set yourselves up to be able to keep this up and be be stable through so much growth.
Yeah, it's a good question, and like I know that there's still scar tissue from people that have entered and left. In fact, we were founded in 2017. In 2017, there was 6 new MA entrants. There is 1 left. Okay, like some are still around, just in other ways. They might have switched to ACA, but there's nobody else in MA. MA is really, really hard.
Yeah.
That's all.
We've seen that paring down of entrants, consolidation of regional players either getting out of the space or getting acquired.
Yeah. And so we look at everything on a 3-year growth horizon, and we look at Medicare, in fact, as a 3-year kind of rolling horizon, and that's how we plan. So we're not looking at this year, we're looking at 3 years down the line at all times. Because that's really in the end what it takes to watch everything bake out. Your star ratings take 2+ years to get baked out before you get anything back. So everything's on that 3-year horizon. This has been obviously a rough stretch because, to be quite honest, a lot of carriers didn't really plan accordingly. It's just, I'll just call it as I see it. We had a lot of changes, V2A, SSBCI, all these things that have been phased in over the last 2 or 3 years. The costs for carriers have gone up tremendously. And we saw that coming, the margin compression coming, and we made some tough decisions. And so this kind of comes back to scale, right? You were exactly right. 2023, we went from 8 to 13. We took 24 off because we wanted to make sure
from new states. Didn't expand.
Right, because we never want to sacrifice the membership that we do have for growth's sake. It doesn't make any sense. So we took the year off, made sure that we were going to be ready for a sprint, because our goal is to be in 50 states by 2030, right? And so we're mid sprint right now. So we took that year off, came back, plan year 25, we added 7 states, and then last year we added 9 states. But in our legacy markets for plan year 25, if anybody out here listening was in Ohio and Arizona, Texas, Florida, we had to make some tough choices. We had those 5 states were on what we would call our legacy plan chassis.
Those are some of your original states, right?
Yeah, yeah. And of course, the benefits were rich because if you can't get to 25,000 members in the first 2 years, you are cooked, done. That's it, right? So you've got to put some stuff out just to like get traction and become viable. And it continues like that. But they were on an old chassis of plan and it didn't perform as well. So going into that year, we see, and when I say we, I really probably mean Ed Parks sees. Like,
Sure. No, I get you. You see the IRA, V28, SSBCI funding cuts, all that coming.
And we realized, hey, these plans are not going to be sustainable.
Right. So this isn't going to be here in 3 years when you're talking about that 3-year curve.
So we just took all the medicine at one. We just made the tough choice. Like, we're not going to unwind this down. And there was things that went into it, right? Like when you design a PVP, you don't have infinite dollars to put into it. There's caps on it, right? So, when you looked at like a dental benefit, which we honestly probably cut back too far, but we look at the data. We look at 82% of our membership uses less than $275 of their dental benefit on average. $275. We had dental benefits out there that were $5,000. That's a waste of money. That's money that's not getting used.
That could get put into benefits.
Could get put into other benefits, a give back, a food and home card, you name it, right? So we peel all those back and we lost membership, right? We went from about 235 down to 212, and that's where we stayed. And then we obviously bounced back big this year, but that's what set us up for the benefits that we had this year. We made that tough decision in advance. And when we had benefits out this year, we were very competitive. And a lot of questions, I got this question a lot, like, you guys look pretty rich.
Are we sure this is sustainable? I had that question a bunch. I mean, we wrote a lot here down in Southwest Missouri, and I asked that weekly of like, there is so much business coming in. Jotham, are you sure these benefits, like, is the comp about to get pulled? Is something about, and like, you guys have stayed the course. And I know he said the whole time, he's like, they're telling me we are so confident in our benefits. Like, this is actuarially sound.
At one point, I looked straight in our head of product's face, and I said, am I going to be sitting on calls telling people we're going to be going suppressed or non-commissionable because we've overbid? And he said, if we ever overbid, you can come here and fire me. Like, that was his response. We have not overbid. He said, we are right in the slot, like dead center.
Hit exactly where you hit your marks.
Yep. And so we plan again this year to be right in the center.
Okay.
And we'll see where everybody else falls, but I think we're going to be really competitive again, just being exactly where we're comfortable.
Yeah, I think that's important to hear because, we have seen at least the last 2 AEPs. I mean, there have been others, but consistently the last 2 AEPs, and I think we'll probably see it again coming into this year, that whoever let's call it the winning carrier was in terms of enrollments, one AEP almost, again, the last 2 years in a row, and I have a strong suspicion it's going to happen again this year, that top carrier took a massive cut the next year. And we saw huge amounts of benefit degradation, service area reductions, non-commissionable, suppression, all of those things. Again, I know you guys weren't, number one in gross enrollments, but number one in growth this past year.
Yeah.
Am I correct? Am I putting you too much on the spot here to say you have no reason to think that there will be a mass pullback this year, that you guys feel like you got what you wanted, benefits will continue to remain stable, continued growth, all of that is the mission?
Yeah, we're open for business. I mean, I got the question yesterday, like, is there areas you don't want to grow? No. We want growth everywhere.
Your product team feels confident that you have not put anything out there that is going to give you guys too much exposure on something, which ultimately is what's led to most of these problems with other carriers. Is it's not everything. It's a handful of H numbers that they got too rich on, they got more exposure than they wanted, and the loss ratio underperformed, and they were going, we gotta get rid of this. It's going to tank the whole thing.
No, I mean, and it's more than just plans. It's how you build your network.
Yeah.
Right. Do you have
getting stuck with bad deals that you're overpaying on a 3-year contract? It's
all of it, right? Do you have risk providers? Do you have the appropriate amount of risk versus, like, there's a lot of factors.
Contracts are by and large all at-risk contracts. Is that correct?
We do have a lot of at-risk contracts, yeah. Because
that's what I was thinking was the majority
we want people that are vested in providing the level of service that we're going to provide, right? And so that's where those do make a lot of sense. There's
part of why the network is tighter in a lot of those areas is that you guys are intentional about what providers you choose to have those relationships with, though, correct?
I mean, could we go out and add every Tom, Dick, and Jane doctor out there? Sure, but there's really no point in that. It doesn't make sense because there's a lot of doctors out there that aren't that great. Like, I'm sorry. I mean, I'm sure they're fine, but like comparatively, there are differentiators between doctors, right? You know, my stepdad was a doctor, and I think he would say the same thing. But it's all of these factors combined. So it really does take the entire engine running in tune, not just plan design. But yeah, from a plan design perspective, I have not a doubt in my mind that we're exactly where we need to be. There's one market which we had plans pressed prior to AEP even, which was Arizona, because that's a market that has its own problems, right? It's a very overpriced, expensive market to work in. And there were some changes just recently with the carrier that said if you're not with a risk provider, you have to either get off of our plan or go find somebody else. So we moved the other 2 PPOs in that market for a total of 5 plans to be suppressed and non-commissionable. But that wasn't because of our benefit design. It was reactionary to the market.
Okay.
So that's it.
That makes sense. That makes sense.
And I mean, I probably shouldn't, but we're incredibly well capitalized. I mean, we're privately held. We've done a Series F. The market is responding incredibly well to what we're doing as a team, and that's what's enabling our growth. So when people say, well, how can you grow so fast? Take on all this membership. Well, it's 2 components of it, right? It's like, one's the entrepreneurial side, and we have funding that helps us go grow, but we're also really, really good at managing this business.
Yeah. Well, I think the big thing that always stands out to me, and you know, maybe this is kind of the summary from my side of things, is that it was very clear to us from when we first took a Devoted contract, I think 3 years ago or 4 years ago now, that everything just felt different about working with Devoted. And, you know, again, the only thing I could relay it to is when we work with, you know, like a small regional type product. That's the only thing I could really relate to, that same type of feel of, you know, it being about the member, it being, you know, just a completely different mindset. But now here we are 3 or 4 years later, you guys are, you know, however many times the size that you were then, and you have kept that up throughout this. So that was really our purpose for this webinar today. I want to make sure that more agents understand the Devoted brand, the Devoted mission, what makes Devoted so much different. And really, my goal would be, as agents, if you have not worked with Devoted much yet, for this to be something that stands out to you, so that if you are sitting there and you're seeing, you know, 2 different plans on paper, like we said, Devoted is not necessarily the spreadsheet winner. It's the member experience, what it feels like to have that plan, their true health outcomes. You have to hear that. You have to feel this. And, you know, you mentioned, you know, Ed Park taking member service calls. He did a webinar with us like 2 years ago. You know, CEO hopped on a webinar for just our agents. Our first year in the market doing this caused some panic on our end of like, oh my gosh, we really got to promote the heck out of this webinar if the CEO is going to jump on it here when we're first time we took this contract. I'm rambling, but all that to say, everything about working with Devoted truly just feels different than working with other carriers. That's, if nothing else, what I hope we got a chance to instill to everybody here today. So
I can keep talking, but you know, we've had such a good relationship and we appreciate it. And yeah, I mean, for anybody out there that hasn't tried it, like, I'm not asking you to take my word for it. Like, I can give you all the stats and I can tell you all the stuff. In the end, you're going to have to make the choice to try it, but just try it. I promise you, like, it's going to work out. Like, your members are going to be happy.
Yeah.
Are we the right fit for every member? Nope. And do we want every member? Nope. But for the people that are a fit, give us a shot. We won't disappoint you. That's all I can say. And I'm glad that you guys have had that experience with your teams, Matt.
Very much. That has been ours. So as we're wrapping up here, I will pause for just a few minutes here. If anyone has any questions to throw in the comment section, be more than happy to take those questions. If not, I would definitely just, again, thank everyone for attending today. We have recorded this as well, so if you want to look at this afterwards, we will make sure that we get this posted up so that you have access to this afterwards. If anyone else from your office wasn't able to attend, or you just want to share it with your friends and neighbors. So again, very much appreciate everybody jumping on. We'll wait just a minute or two here to see if there are any questions. Matt, any last closing comments or remarks while we wait on any final questions?
No, just appreciate the time. I know everybody's busy, so anybody that's willing to come here and listen to me talk, I'm always appreciative of it, and I'm always appreciative to get the chance to represent Devoted. To be quite honest, it's not very often that in this world that we live in that everybody gets to wake up and be this passionate about the company that they get to work for, and so I'm very blessed for that and very appreciative of that. And we love the opportunity to sit and talk to agents and you guys whenever we can.
Perfect. I do have one question that came in here. And I don't know if this is information you will be able to share yet, but they were asking, we are aware of the expansion states, but are you aware of any plans or any information you can share around expanding county footprints within your existing states?
So we can't share counties yet. Okay. What I would say is expect our county announcement probably the first at latest second week of May.
Okay, that's when so about a month, a little less than a month out from that.
Yeah, probably. So that's the next big goalpost for us. That's when we should have adequacy in all of those counties.
Okay.
Be approved by all those counties. From there, then obviously it's certifications. Our certs are opening up on the 23rd, which is the day after AHIP. And then around that time, should be hopefully on that day, we'll release what we call our BPAG, broker plans at a glance.
Yep.
In lieu of having a first full looks come out, which nobody does anymore because we really can't because of NABRA adjustments.
Yeah, say everything changes now after rebid.
Yep, it's just too big, the volatility to it. You put yourself at a really big disadvantage.
No, but I like that you guys put out that early look. It gives kind of the high levels, gives you an idea of what the plan design is going to be.
You've got the whole framework of the plan design. You don't have the benefit amounts, but you can see exactly the types of plans that we're going to be entering with. But, in addition to geographic expansion last year, we had a massive expansion in our just number of PVPs where we had historically kept a pretty straightforward product portfolio, like 4 or 5 PVPs for every market. Last year we had markets with up to 14. We went from 1 CSNP type in 2024 in 3 states to having 3 unique CSNPs, and we had 1 in every single county of our footprint. So I would anticipate, again, having a lot of CSNP. We're going to still be heavy in PPO, HMO, like every plan type, we're going to have something out there.
Okay. And can you comment on, will there be expansion within existing states, even if you can't give us specifics? Okay.
Yeah, I don't know exactly what the counties will look like.
Can't go into specifics at this particular point on the calendar yet.
Yes, correct. Like I know, a state like Iowa was a really, really small entry for us last year. We'll have some expansion in Iowa and other states. But I would say right now we're in 999 counties. My guess is we end up somewhere around maybe 1,500 total is my guess.
A lot of growth. And I know we've seen that be kind of your guys' MO the last few years is year 1 in a state is kind of take it small. Year 2 is really when it seems to be that you guys really hit the state hard.
Yeah, you enter and you put an anchor down, right? And you get a base built in 1 or 2 areas, and then you go from there.
Perfect. Okay. I don't see any more questions coming in. So with that, Matt, I will thank you for taking your time with us here. If anyone runs into any more questions, please do not hesitate to reach out to our team. Oh, sorry. Go ahead, Matt.
Who are the Chiefs going to take with pick 9?
Oh man, see, I'm team pass rusher. So Ruben Bain is my pick here. I hope we get him. I'm okay with the T-Rex arms. I think he's worth it.
If he's there, I'm with you.
Good closing question. Me and Matt are both Kansas City guys originally. Okay. Well, thank you, everybody. If you got any questions, feel free to reach out, smsteam.net, or call our 800 number, 800-689-2800, and our team will be happy to help you out. So thank you guys so much. Have a great afternoon. Thanks, Matt.
Thanks, Matt. Good to see you.